Hi, class. My name is Timothy Humbane, and I am a member of the Team Health is Wealth initiative along with Morgan Greening and Mackenzie Huddleston. This is a recording for our digital artifact. The artifact is accessible below at view.genially.com and can be viewed with or without the recording. We hope you enjoy our artifact and are inspired by the information to enhance our digital perspective. Technology choice. Our team will use Canva and Genially to create the digital artifact. Canva enables us to design engaging infographics and digital explainers that communicate health information clearly and professionally. Genially adds an interactive dimension, allowing us to present information through dynamic visuals, clickable presentations, and data storytelling. Together, these tools balance clarity, interactivity, and engagement in presenting health education content. By choosing Canva and Genially, we ensure that our final product is both accessible and impactful, maximizing usability while minimizing technical barriers. Slide 2. Introduction. The Sustainable Development Goal number 3 aims to ensure healthy lives and promote well-being for all at all ages. Yet gaps in access to reliable healthcare persist, especially in underdeveloped areas. Digital tools provide an opportunity to close these divides by increasing access to education and care. Our backstory for Team Health is Wealth. We chose the United Nations Sustainable Goal number 3, good health and well-being. The main focus of this goal is to prioritize good health and well-being for quality of life. We figured that this resonated with our team's name and chose to focus on the healthcare divide between various countries and communities, showcase how digital access to healthcare services like telehealth can benefit people globally. We realized that access to healthcare globally is not equal and various barriers prevent the access, like COVID-19 pandemic, which highlighted incorrect views about the dangers of the virus and preventative measures like the use of vaccines and masks to prevent illness. Other examples of the healthcare divide are underdeveloped nations like Africa, rural communities, and even our own country, which do not have access to a doctor's office. Digital healthcare can help fill this void and provide access to healthcare professionals and information to promote a healthy lifestyle and prevent illness. Slide 3. Problem statement. Millions worldwide, especially in underserved or rural communities, face barriers to healthcare and health education. COVID 19 highlighted these inequities as communities without digital tools or telehealth experience worse outcomes. Digital health education and telehealth can improve access, strengthen preventative care, and empower individuals globally. The global disparities. Digital healthcare tools can help level the playing field for underserved populations. Telehealth reduce inequities in Africa. The digital health potential, expanding access to remote healthcare can empower communities to better manage their health. Telehealth improves rural health literacy. And the COVID 19 impact. Communities without digital tools faced worse healthcare outcomes. COVID 19 highlighted global disparities. So the hypothesis is we if we leverage accessible digital health education tools alongside telehealth platforms, then individuals, particularly in underserved and rural communities, will be empowered to make informed health decisions, seek timely medical support, and adopt preventative health practices. This approach will reduce preventative illness, narrow health disparities, and improve long term wellness outcomes globally. The challenge selection is it was selected because, as our name says, health is wealth, which means our health is our greatest wealth. Prioritizing this is crucial to a healthy life, and it is an endemic that there is unequal access to something as necessary to life. It's a very relevant topic that can affect everyone in a rural community or country. Hopefully, our final project will bring awareness to this problem and promote better health worldwide through digital health services and education. Slide 4. COVID-19 and telehealth guides. Oh, telehealth apps provide a structured and accessible way for patients to connect with providers remotely. Mobile internet based teleconsultant apps may have improved access for underserved communities. It allows you to download and open the telehealth app on your device. Then you can register and log in to verify the type of provider you would need and select a doctor. And then you can join the video consultations and discuss symptoms, receive guidance and prescriptions. And you can also review post visit instructions and track medications and schedule follow ups. Okay. The development process is our process was split amongst the three Health is Wealth Initiative team members. Each week, we completed the agenda and product plan and had a meeting to discuss the following week's tasks and outline to complete our final project. We divided the tasks required by our strengths to convey the strongest message most effectively. Slide 5. Building digital health skills. Okay, so with this, if it will load, it's fine. It allows us to learn how to navigate health apps effectively, understand online patient portals for appointments, records, and messaging, hands-on sessions for patients to practice digital health skills, and apply learned skills to manage your health independently. Slide 6, mobile health tools and applications. This allows to schedule appointments, access records, and manage medications. Digital literacy is linked to better digital health behaviors in rural populations. Then it allows to track heart rate, sleep, and physical activity. Wearables and remote monitoring devices empower patients and support preventative care. And then the devices and apps work together to improve our continuity of care. Over 50% of mobile users in emerging economies can access health apps, bridging gaps in traditional healthcare infrastructure. Connecting the patient and providers remotely and improving access to underserved areas is the purpose of mobile healthcare tools and applications. Slide 7 is our patient-centered programs. The campaigns and programs help patients practice using apps and portals to manage appointments, records, and messaging independently. Telehealth reduced inequities in Africa and improved vaccine distribution. Real-time digital health platforms enabled case tracking, contact tracing, and data-driven vaccine allocation. The digital health supports universal health coverage and improves life expectancy and enhances access to both rural and urban communities. And then countries leverage mobile apps, AI dashboards, and teleconsultations to monitor disease spread, inform public health policies, and educate populations. And slide number 8 is patient-centered programs number 2, which is showing the telehealth use over time in rural communities, showing the use of it pre-COVID, during COVID, and even post-COVID. The patient-centered telehealth programs strengthen rural healthcare by improving accessibility, comfort, and satisfaction. Evidence shows patients prefer telehealth when supported by trusted providers and reliable internet. The willingness to use telehealth increased from 59.7% to 67.5% when recommended by a healthcare provider. Then, comfort with telehealth is shaped by internet reliability. Patients with stable connections report significantly higher confidence. And then rural patients prefer telehealth most for primary care visits, emphasizing provider trust. And then now, slide 9 is a digital health education and training. Comprehensive digital health education programs equipped healthcare workers and communities with digital literacy, precision health knowledge, and preventative care practices. Training ensures effective use of telehealth and mobile health platforms. Then, professional training. E learning programs train healthcare professionals in telemedicine, diagnostics, and patient education. Community education. Digital literacy initiatives empower patients to access reliable health information and adopt preventative health behaviors. And then the global impact. Programs in Africa, Asia, and Latin America have increased engagement with digital health tools by 15 to 25%. Okay, and then going over what we learned. While completing our project weekly, we learned the value of hard work, dedication, and team collaboration, negotiating skills, and adaptability. Working with a team is more beneficial than working alone, but also comes with challenges. The synergy amongst the three of us was vital for our success, and we fostered this result with frequent communication and trust among our team members. One lesson from this class, Honor 490, learned is that we can accomplish anything we put our minds to as long as we have organized leadership, healthy communication, and organic collaboration. These are the members of Meeting Team 2 Health is Wealth Initiative. It's Mackenzie, Timothy, and Morgan, Good Health and Wellbeing Digital Artifact Gallery, and it shows that our class for University of Arizona Global Campus for this Honor 490 Honors College Seminar with our professor as well. And then these are the references used for the final project. Well, thank you very much for reaching the end of our slide and showing our official final project. We hope you all have a wonderful day and take care. Bye-bye.